Hello everyone, I am Aarti Goyal from Mapples Academy and today I am here with you with a new topic that is first aid. In this chapter, we will learn about first aid, identify the situations where first aid is necessary, discuss the first aid steps to be followed for some emergency situations. So, let's begin. Firstly, we will get to learn about the first aid. First aid is the immediate help given to a sick or injured person before taking him or her to the doctor is called first aid. It can provide some relief from pain and can prevent injury from getting worse. Different kinds of first aid are given for different injuries like cut and scratches. Cut and scratches are common injuries where the skin gets broken or scraped. They may happen due to sharp objects like glass, knives, or falls. First aid for cuts and scratches. Wash your hands before touching the wound. Clean the wound gently with clean water to remove dirt. Apply an antiseptic to prevent infection. Cover with a clean bandage or dressing. Keep it dry and clean and change the bandage daily. If the cut is deep or bleeding heavily, take the person to a doctor immediately. Next is sprain. A sprain happens when the tissues, ligaments that connect bones get stretched or torn. It usually occurs in the ankle, wrist or knee due to sudden twisting or falling. First aid for a sprain. Rest the injured part, do not move it too much. Apply ice wrapped in a cloth to reduce swelling. Use a bandage to support the area but not too tightly. Keep the injured part raised to reduce swelling. If the pain is severe, visit a doctor. Fracture. A fracture is a broken bone. It can happen due to a fall, accident or a strong hit. The person may feel severe pain, swelling and may not be able to move the part. First aid for a fracture. Do not move the broken part. Support the area using a splint, a straight stick or board tied with a cloth. Apply ice to reduce swelling, not directly on the skin. Take the person to a doctor or hospital immediately. Next is nosebleeds. A nosebleed happens when blood comes out from the nose. It can be caused by heat, injury or nose picking. First aid for a nosebleed. Make the person sit upright and lean slightly forward. Pinch the soft part of the nose for about 10 minutes. Do not tilt the head back. It can cause blood to go down the throat. Apply a cold cloth or ice pack on the nose or back of the neck. If the bleeding does not stop in 15 to 20 minutes, get medical help. Burns. Burns are injuries caused by heat, fire, hot objects, chemicals or electricity. Burns can damage the skin and are often very painful. First aid for burns. Cool the burn by running cold water over it for 10 to 15 minutes. Do not apply ice, butter or toothpaste. Cover the burn with a clean dry or bandage. Do not burst any blisters. Take the person to a doctor if the burn is deep or large. Animal bites. Animal bites from dogs, cats or other animals can be dangerous because they may cause infections or diseases like rabies. First aid for animal bites. Wash the wound immediately with soap and running water for at least 5 minutes. Apply antiseptic to prevent infection. Cover with a clean bandage. Take the person to a doctor immediately. Get anti-rabies injections if needed. Poisoning. Poisoning happens when a person swallows, inhales, or touches a harmful substance like spoiled food, medicines, chemicals, or insect bites. It can make the person very sick. First aid for poisoning: do not panic, keep the person calm, do not give anything to eat or drink unless told by a doctor. Try to find out what poison was taken. Take the person to a doctor or hospital immediately. If the person is on the skin, wash it with lots of water. Safety from fire. Fire can be dangerous, so we must follow safety rules to prevent burns and injuries. Fire accidents can occur while cooking in the kitchen, dusting crackers, burning matchsticks, using matchsticks, and due to electrical faults. So, to prevent fire accidents, we should follow these safety rules. Never play with matchsticks or lighters. Stay away from firecrackers and stoves. Do not wear loose or synthetic clothes near fire. Cover your nose and mouth with a cloth if there's smoke. Use stairs, not lifts, during a fire. Call emergency services like fire brigade immediately. Fire spreads very fast. Hence, it is important to control it as early as possible. In case of fire, raise an alarm and call the nearest fire station. In case someone's clothes catch fire, cover the person with a blanket or thick cloth. This would cut off the oxygen supply and the fire would extinguish. Water can be used to put out fire. If your clothes catch fire, stop running because it can increase fire due to an increase in oxygen supply. Drop to the ground immediately. Roll. Cover your face with hands to prevent injury to the face. Roll over and over to put out the fire. So, in case of fire on clothes, stop, drop and roll to put out the flames. Thank you.